a mobile-based application is helping consumers find the right healthcare for them. LASO Health has more.
Good morning, Dr. Hamed Mazani. It is so nice to get to meet you. You have created something that I think will help a lot of San Antonians and people in general. How are you this morning?
Doing well. Thank you for asking.
Yes, absolutely. So tell us a little bit about LASO Health. It's basically healthcare in the palm of your hand. A lot of people can get many resources through this app.
So I've been a physician here in San Antonio for about 20 years. I graduated from my specialty training here from UT San Antonio. So San Antonio is my home. And I've been practicing medicine and seeing that patients really have difficulty navigating through healthcare. So they're afflicted with the illness and they're just lost. Typically, if they have access to their primary doctor, good, they go visit them. But there's really no transparency in the pricing. So you go visit a doctor, a hospital, or get an MRI, a CT scan, you really don't know what everything costs. And so I came up with the idea that perhaps we should have a tool, much like you have tools on your phone, that apps that navigates booking a trip or restaurants, but for healthcare. But not only just book it, but rather negotiate the price with the provider and without a middleman, and you basically pay up a upfront pricing very transparently, and it's done. It's one bill and you're done with it. That way you can plan your life. So that is LASO Health.
That sounds very helpful. And I know that that's probably the only time you'll have to pay because the app itself is free, right?
Correct. So the app is free for the doctors, providers, as well as patients. The transaction, if it happens, basically is a small portion that the patient fee pays for that, and that's over. But you upfront know what the pricing is, and that's critical.
Is there anything else people should keep in mind when they are using the app?
So it's very simple. You download it both from Apple Store or Google Android phone. It asks you if you can follow your location while you use the app, so it can find the nearest provider to you. And there are categories that you can choose by symptom, how you're feeling. It sort of finds you a doctor that takes care of that, or you can choose by specialty, what doctor you want to see. You give him the time and date that it's more convenient for you, and basically finds the closest appointment, gives you a series of choices of prices. You choose it, you pay, it holds the funds. Once that's done, the app pays the provider, that's over. You're done, you will never see a bill. Not only that, you also get to see who is the doctor that's going to take care of you. You'll see later on ratings of doctors. Do they have good outcomes? Also, you may actually see a video of them, so that when you walk into that room, that's not the first time you see the provider. You've sort of visited them before online.
And you're saying that this helps minimize a lot of those surprise medical bills that people might receive, huh?
Absolutely. If you've been in the healthcare, if you've been in a hospital, 2 months later, you keep getting bills and different bills. And are you in network, out of network? And you have absolutely no control over the price. So it's not transparent. And I think it's clear to say that San Antonians own $100 million in medical debt that they did not look for. And 70% of the medical debt, it basically drives bankruptcy, in America. So we should do things, create tools, get creative, and fight against this pandemic.